Nicola Hill, who joins us live from London. Nicola, do we know why this is?
Well, the main reason is the fact that many of these people are in contact with the public quite a lot, even during the pandemic and even during lockdown. Professor Neil Pearce from the London School of Tropical Medicine said it's not really rocket science if you consider a bus driver who has a whole load of passengers on there. They may be asymptomatic, they might be brewing the virus. He's bombarded with potentially the virus on a daily basis. And think of taxi drivers in a very closed environment. Again, you've got different passengers coming in day after day, hour after hour. Each time he's vulnerable to getting the virus and to getting a greater viral load. And then, as you say, you've got construction workers, security guards are actually most at risk because they're seeing the public as they walk by and everything like that. So it is this fact, it's this face-to-face occupation. Those are the people who are most at risk, so this face-to-face possibility. Interestingly, this study didn't look at ethnicity. So we do know that people from a black and minority ethnic background are unfortunately more at risk from COVID-19. And they also often represent a large proportion of people in these low paid jobs. So that might have something to do with it. And also, it didn't look at health, underlying health conditions. So it might be people from poor health.
And Nicola, back to the actual ONS statistics with regards to the job you do and whether you're a man or whether you're a woman. And what's the reaction been? Because surely this now gives people something to go to their employers with to say, look, you need to put in more measures or look after me better.
Exactly, Maria. That's what the trade unions here in the UK are saying. You know, you can't expect people to go back to work, which is what's going to happen tomorrow. We've got this lifting or limited lifting of the lockdown, where people are being asked if they can't work from home to go back to work. And of course, the people who work from home often are the white collar workers, the ones who don't seem to be as badly affected by the virus. So you've got the trade unions saying that this is a class divide. You know, the poorer are more at risk and more needs to be done for them, whilst the richer can cocoon themselves and avoid this public contact. The women who were affected were the care workers. They were twice as likely as women were in a white-collar job to be affected. And that's probably because of the lack of personal protection, which is an issue that's been ongoing here in the UK. And one of the elements that's also come into play, as I say, was people's poor health and their background. So if people are suffering from underlying health conditions, or if they have a sedentary job and they don't have access to hand washing or to hygiene in the same way, then they too are going to be much more vulnerable.
Nicola Hill, thank you very much indeed for the update from London.